Meeting is called to order. Michelle, if you could take the attendance.
Certainly. Strassman. Hilla.
Here.
Roberts.
Here.
Cronin.
Present.
Johnson.
Here.
Kaiser McHenry.
Here.
Schnapp. Lugenbull. Lonsdorf.
Here.
Anderson.
I'm here.
Dostalek. Okay. All right.
We have a quorum. So, Chief, if you're ready for the swearing in.
Sure. We had no public comment, so.
Right, there were no public comments.
Does that work? All right, they're not all like this, so I'll apologize to. So this is, I don't know if you've met the commission. So this is, his name's Donald. He goes by Chip. Is that okay?
Yes.
All right, so we'll actually have you stand, we're going to sit right over here, or stand right here. So Chip is our new employee. He's been here a couple weeks, almost 3-4 weeks. He's actually been in LTE with us since about a year ago, right? Ish. So he's going to do a swearing in with us for the district tonight, and then his family, if you want to introduce him when they come up here, we'll pin your badge on you. So we'll have you raise your right hand. So it's please repeat after me. It's we'll go with your full name. So I, Donald Hankley,
I, Donald Hankley,
as a sworn paramedic of the Fitch-Rona EMS district,
as a sworn paramedic of the Fitch-Rona EMS district,
swear that I will faithfully, honestly, and impartially discharge the duties of a paramedic
swear that I will faithfully, honestly, and
impartially
impartially
discharge.
discharge the duties of a
There
paramedic.
you go, thank you. And I pledge to carry out these duties
And I pledge to carry out these duties
to the best of my ability.
to the best of my ability.
I will honor and respect
I will honor and respect
the mission, goals, purpose, and policies
the mission, goals, purpose, and policies
of the district and the administrative rules of the state of Wisconsin,
of the district and administrative rules of the state of Wisconsin.
and I recognize the badge of my position
And I recognize the badge of my position
as a symbol of public faith and trust,
as a symbol of public faith and trust.
and I accept this position
And I accept this position
so long as I am true to the ethics of the emergency medical services profession.
so long as I am true to the ethics of the emergency medical services profession.
I make these promises solemnly, freely, and upon my honor.
I make these promises solemnly, freely, and upon my honor.
That's it. Thank you. And this time we'll have your family pin your badge.
This is my wife Heidi and my daughters Maya and Lily.
So this is Molly Olson. She's our intern. We kind of mentioned her last month, so we'll have you come on up here. What we'll do is a swearing in for you, and then we'll have your family come up and pin your badge on you, okay? They'll try to pin your badge on you. Normally we got to cut holes in the shirt, so we'll do, yeah. All right, so thanks for coming up. So if you can raise your right hand and repeat after me. So I, Molly Olson, as a sworn emergency medical technician of the Fitch-Rona EMS district,
as a sworn emergency medical technician of the Fitch-Rona EMS district,
swear that I will faithfully and honestly
swear that I will faithfully and honestly
and impartially discharge the duties of an EMT,
and impartially discharge the duties of an EMT,
and I pledge to carry out these duties
and I pledge to carry out these duties
to the best of my ability.
to the best of my ability.
I will honor and respect
I will honor and respect
the mission, goals, purpose, and policies
the mission, goals, purpose, and policies
of the district
of the district
and the administrative rules of the state of Wisconsin.
and the administrative rules of the state of Wisconsin.
And I recognize the badge of my position
And I recognize the badge of my position
as a symbol of public faith and trust.
as a symbol of public faith and trust.
And I accept this position
And I accept this position
so long as I am true to the ethics
so long as I am true to the ethics
of the emergency medical services profession.
to the emergency medical services profession.
I make these promises solemnly, freely, and upon my honor.
I make these promises solemnly, freely, and upon my honor.
Well, let's move on to review and approval of the meeting minutes from May 19th, 2022. Any comments or corrections? If not, a motion to approve?
I'll make a motion to approve the minutes from the April 21st meeting.
And second? Okay. All in favor signify by saying aye.
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 Anybody opposed signify by saying no.
I'll abstain, I wasn't here.
Thank you. So the minutes as submitted for May 19th are approved. We'll move on to the chief's report. We may be talked out by now.
I think it's harder for them to remember all that versus me to talk it out for them. So you'll see the chief's report out there. This was emailed out to you. As you see, just the usual, that number that we kind of always look at is that call per month there. So we were up again pretty high last month at 381, ties with December of last year. So again, it's one of our top three numbers. So it just still continues to see that number go up. Otherwise, the proportions up there are usual. So we're still at about 11.13 calls per day, about 12 calls per day. The breakdown of our calls per week and calls by municipality, again, we're just starting to see a little bit more, a little busier up in Fitchburg, which we tend to kind of see over the course of the summer anyway. There's our calls for service, our top 70%. The usual sick and falls people just keep flopping back and forth. Station 2 continues to be our busiest station. That's the one on Marketplace. As far as our financials go, things are where they should be. As you can see, we're starting to kind of see, as I mentioned last month, the income be up a little bit higher as we have raised our rates there in January and that increase in call volume. Our cash on hand is right where we should be. We're higher than we were the previous year. There's our expenditures, nothing out of the ordinary there as well. Really, the only other income is the little bit of interest we've got there as well. July 1st was right around the corner, in which case we'll be billing the municipalities for the second half of our money for the year. Our assigned balances are right normally where they should be as well. If you remember, we voted to cash in that ambulance sale purchase, so that's going to be on there for a couple more months till that falls off, and then we'll just report where our FAP funds are, that restricted funds. And then again, our WISC account is that CD that we don't get the interest on until the fall. No new donations. June was a big hiring month. Molly Jesberger, who was a combination of part-time and full-time, so she's a current full-time, is 20 years with us. Tom Bates is still our last volunteer hanging out there at 32 years. Ryan Robertson, Jamie Ennis, and Cam were all part-timers that started with us. Ryan Robertson, if you remember, is our last full-time hire. Oh, Chip is now our last full-time hire, but Ryan has been with us for 1 year was about 6 months as a part-timer, and then is with us as a full-timer for about 2 years. And those are our milestones. Let me pull up the financial. So here's where we're currently at to date with our in-house budget for 41% through the year. Our run income has actually been higher than we anticipated, up at 48%. So we've received 50% of our funds from the municipalities. Overall revenue, we're at 49%. So we're right where we should be. As far as the rest of our expenditures, again, we're at 41% of the year. We're at 41.4% through the year. So salaries are right where they should be. Things we're seeing to be a little bit higher, as you can imagine, is the price of fuel is going through the roof. So we have these gas guzzling trucks that we drive. So we're already a little bit higher on fuel, as well as our medical supplies, which we always know is a lot higher. Still running into a handful of shortages with things like saline, flushes, gloves still kind of present to be a challenge every once in a while. But those costs are high. Nothing else astronomical there as far as the rest of our budget goes. So as far as expenses, we're at 37.5% through the year versus where we're at 41%. So we're just a little bit under our expenditures for the year. But we also have some of those payments, again, remind you, that are like quarterly payments or semi-annual payments that we will see come out later. Any questions on those? Other notes I have as far as the chief reports is I emailed it out to you. We finally got a final version of our audit done. They started that back in beginning of February. It just took a while to get that finally closed out. Michelle and I met with them at the first week of June, and you got that final draft sent to you. They will come do that presentation in July. That has been sent to the municipalities to kind of put closure to their audits, the municipal audits as well. The contract negotiations is kind of not had any momentum to it, I guess, with Kyle leaving. Kyle was the previous union rep. So it was a couple weeks till they kind of got determined what the plan of succession would be. Greg Bailey is the new union rep. I believe last time I checked in with him, they were the first week of June there, so about 2 weeks ago, where they were finally putting their negotiation team together. I think they have yet to have their staff meeting to put their kind of initial proposal together. So we as a district have met, but we're still waiting to get a date from them. I have been going back and forth with Leslie, who's our labor attorney, on what some of our initial proposals was. She had another chance to look at it and clarify some wording in there. So no new updates on that front. Next week, we will be doing a hiring process, as we mentioned last month, as part of that personnel committee, bringing on some volunteer EMTs. So we have put that hiring process together. They will come in and do our physical agility test that we require of all of our applicants, and then do that screening process. And then we'll also be looking at hiring some more part-time, those LTE paramedics. So they will come in. Their hiring process is a little bit different. They do a physical agility, but then they also actually do a written test and a scenario test. So a little more scrutiny on those medics, since they are the ones who actually do the two medics in our ambulance. That's what I have for my chief's report.
Thank you. I kind of did a quick calculation, and if we continue at the current call rate, we'll go over 4,400. Last month, we were kind of projecting 4,100, I think.
Yeah,
That'd be interesting.
it's a complete,
Busy.
it's a complete guess, as I kind of do the average and what we have left, but
Yeah, who knows, it was a good change, but yeah.
looking at about a 6% increase overall.
Okay, thank you. Personnel didn't meet.
Can I ask a question? When we talked about raising the rates 6 months ago or something like that, we were, or at least I had a concern that it might increase problems with collections of people who can't pay their bill. Have you seen any kind of change in that you noticed yet?
So, Michelle, I give you off the top of your head, can you remind me? The beginning of the year, I had quite a few of them, but those are still split. I've got those numbers. I can actually share that with you.
We've gotten maybe a few more hardship requests, but I haven't seen anything like a big, push or anything like that.
I do actually, we do have real numbers. I do keep track of that. If I'm remembering it off the top of my head, we are higher than we have been in the past, but it's still not like a huge number.
We are. We are a little higher, like you said, and you and I discussed that because we factored that into the budget a little bit there.
But I don't know that that's necessarily related to rates or jobs or unemployment or every one of those is a written request with kind of the reasons why they're asking for the hardship. Mm-hmm. And most of them aren't. Most of them, it doesn't matter what we would have charged, they wouldn't have been able to pay. We're just writing off more because it's higher.
Okay. Finance met, I don't know, is there, want to do an update on that, Dave, or?
We just met 20 minutes ago, and I think we're going to be presenting the budget at the meeting. That was all we talked about.
Yeah, so I'll pull up.
Okay.
Or do you want to talk about it now?
Well, kind of how we ended the last meeting. I'm not so sure that it would be. It might behoove us to wait a month. I can give you the preliminary stuff. We found actually a calculation error to the benefit of the municipalities this time, so that's probably actually okay to share that one. Let me share the screen.
While you're doing that, we're not going to do any kind of just in-depth discussion today, or did you want?
Well,
I was going to recommend we table until July.
Yeah, I'll give you
Move to table, because it's not in a form where it would make sense.
Yeah.
So we
my
make
suggestion
that.
would actually be to wait. Is that a pretty good assumption?
That's just my opinion.
We did talk about it at the finance committee. Essentially hit the kind of the expenditures in there. The hiccup came as, again, checking what happened in the equalized value formula. It actually started determining the percentage of increase off of last year's number. Those numbers didn't come over, which actually changed that percent significantly.
Yeah, so
as opposed to giving sticker shock to what would have been the original one I emailed out to you, this is much more palatable. So I just want to make sure before we throw it up there, it's probably a better recommendation to wait till next month.
Yeah, can you second a motion to table? I'll second it if you want, yeah.
Okay, We'll table it till, I don't think we need to vote on that. We'll just table it till next meeting.
Okay.
It really wasn't on the agenda anyways.
No, this month would have been a presentation, so you could look at it and let me determine kind of if things needed to be altered or tailored. And then next month, so we will need to vote on it next month.
Next month, okay.
Because Fitchburg is usually right around the beginning of August when it's due to them, and then usually a couple weeks after that, it goes to the other two
Okay,
municipalities.
so you'll mail out up to
I
the
will,
version before and,
next week or so, I will email out, and then if you have questions or want to do a one-on-one, I can go through it then, as we kick it around a little bit more.
okay, sounds good. Any more discussion? Otherwise, we'll move on to review and approval of the accounts payable checks. I looked at them, I didn't see anything. Anybody have any questions? If not, a motion to approve is submitted.
I'll make a motion to approve the checks as submitted.
Second?
Second.
Okay, all in favor of approving the accounts payable checks as submitted, signify by saying aye.
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 Aye. Anyone opposed, signify by saying no. The motion passes. The accounts payable checks as submitted are approved. And we'll move on to a review and approval of the Gatsby 54 fund balances, our monthly
Yeah,
review.
so we haven't seen this in a while. For anyone new, you can kind of read, I did email it out. It's a total accounting thing. We haven't done it in a couple of months because it changes January 1st based on the audit. So now that the audit is complete, actually, we know what these numbers are. Essentially, it just says that we have this pot of money out there, but that we can't spend it all because some of it's actually already pre-spent. And so those are the new numbers based on the audit that was finalized a month ago, that essentially $63,000 of the assets of Fitch-Rona is actually sitting in supply rooms. $48,000 is stuff that we have committed to expenditures in contracts of varying, a lot of technology subscriptions, those kinds of things. The FAP funding is the one you see every month. That $220,000 is what's sitting in our post-retirement healthcare, and that $24,000 is what's sitting in our contract negotiations. So it's really those first two, those first two numbers that are new this year. And then the other three actually kind of just change over time. But so you just need to approve that I can't spend that money for not on those things.
Any discussion, comments? If not, a motion to approve the Gatsby 54 is presented. A motion would be in order.
I'll make a motion to approve the Gatsby 54 as presented.
A second?
I'll second it.
All in favor of approving the Gatsby 54 as submitted, signify by saying aye.
Aye.
Any opposed, signify by saying no. The motion passes. The Gatsby 54 for June 2022 as submitted is approved. I could probably sign that too if you have a copy. Okay. Whoops, I see we did have the draft operating budget. I guess we tabled that, so we'll move on. Any other business? Anybody have anything they want to bring up?
Not to put you on the spot, Dr. Mancera, but got anything for the better of the group?
Mike Mancero, the medical director for Fitch-Rona EMS.
Didn't know I was going to have you come
No,
up.
thank you for the invitation. Mike Mancera, the medical director for Fitch-Rona EMS. Thank you for the invitation. Apologies for being a couple minutes late. No major updates from my end. I think a huge thank you to our leadership and providers. I think, as Chief mentioned, it's been significantly busy in terms of call volume and run volume, as well as continued to be higher acuity calls over these past couple months. So certainly appreciate the hard work of the providers, hard work of the chiefs, and the support of this committee and commission. So it's certainly been a busy couple months on top of a busy couple of years. So I think everyone's working hard, and the good news is I think their work is paying off. So appreciate all your efforts. Thank you for having me. And I'm happy to answer any questions if anyone has any other questions. Yes, sir.
Why do you think the run volume has gone up so much in the last year?
Good question. I think the multifactorial. I think that's just been the trend both here locally as well as nationwide. And it's not only within the pre-hospital setting. I mean, this is throughout healthcare systems are just also seeing a huge, significant increase. Difficult to answer that concisely as to why. I think there's a lot of factors aside from just COVID related.
Well, if I could follow up, Middleton, I think we saw statistics, Middleton has gone up about as much as we have. Sun Prairie has not. They've only gone up a few percentage points.
Yeah, so that's interesting. I would say I've seen pretty consistently that most services were up around 20% over this past 6 to 12 months. So that's been fairly consistent. As to why some services aren't seeing that increase, I think that's few and far between.
All right. Has there ever been an attempt to analyze the runs to see whether there was anything we could actively do to decrease the number of runs or to manage that number?
Yeah, I think the good news is that this service, and including other services nearby, have taken proactive measures to try to decrease runs in terms of prevention of having 911 calls initiated initially. So that goes back to things along the lines of community paramedicine and preventative programs. So there certainly are efforts to decrease calls, absolutely.
I'm just wondering if you're aware of anything that's worked. It's an odd amalgam here because we're partially a business where we get money for the more runs we do, the more money we take in. But we're also a community service where the more runs we do, the more we charge all of our municipalities. So it's not really clear whether we want more runs to make the business better or we want less runs to make the taxes lower.
Yeah, I think that's always a challenge. I mean, I think you're right. I mean, I think matching the right resources to the right call volume is the appropriate approach. But we certainly, at least from our standpoint, we're not rooting for a significant increase in call volume because we only do have a finite amount of resources. So as far as what has been effective, I think every system and every agency is a little bit different in terms of what that most effective measure is. And I think that's why you'll see programs and initiatives continue to see what is effective in terms of trying to reduce that number. But there is no magic answer, unfortunately, right now.
We do have two. So we do work with a group doing fall prevention. As you can see, we talk about that every month is fall and sick people. Sick people is just kind of that generic 911. We'd like to be doing more fall. To me, fall prevention is probably one of the biggest things we could intervene on, and that's getting into those facilities and doing education. I don't know that we do enough, and as you said, I don't know that we can quantify that we actually make a difference. But I think it's one thing we need to try to continue to do. And the other one is I would like to think is that leave a dose, the leaving the Narcan with our overdose patients. And that's when I don't know, again, if you can just look at it to say, are we making a difference in reducing calls in the county, or is it just still such a prevalence of an epidemic truly that it's growing and we're, are we impacting it, but it's growing faster than we're making the impact? Those are the only two I can really think of off the top of my head. We are meeting next week. So Sun Prairie did get some grant funding to do some community medicine. And I know their biggest challenge has been staffing, just trying to staff an ambulance and get out there in the community. So we're actually meeting with them next week to try to partner a little bit to see if we can help them with something and potentially kind of what the guidelines. I don't know enough about the program to know if it's limited to the District of Sun Prairie. I don't think it is. Can we grab, do we have the capacity as well to bring some of what they're doing here to Fitchburg and Verona? So I'll let you know how that pans out.
What was that initiative, I think last year you were talking about, where this is what I remember anyway, where the paramedic, if the person really probably didn't need to go to the ER, they'd spend some time, they'd go in their home, they'd interview them about support network, maybe help them with meds and how would you fill that out in pillboxes and things like that. What about that program?
Sure. So the challenge has just been getting back out and doing it. It's the whole COVID thing is like, I don't want to use it as an excuse, but it's still kind of an excuse. That comfort level of people and going into facilities is still just kind of, there's people who are comfortable with it, there are people who are not. And then it's finding our own people who are available and willing to come in and do that. So we have not gotten that, not nearly back up to the speed where we were prior to COVID and going into facilities to do that. So I'm hoping maybe this project with Sun Prairie will give us some additional funding as we talk about budget. Right? That's always the thing. For me to bring in somebody to do that, I'm bringing them in on overtime. So if we can find this grant opportunity or find some of that additional funding to bring people in to do that, that's not, would like to, same thing you said, right? We don't want to reduce runs because that's income, but at the same time, we also don't want to wish death and destruction on people. So the more people we can keep out of the hospital, the better. That's also part of our job. So I'm hoping maybe this will spur some of that back on.
Well, if I can just say, the only information the commission gets about what the runs are for is the stuff that's on the chief report, which is really not very helpful in terms of if we ever wanted to try to reduce them. It says sick person, somebody who fell over, didn't look good to some, whatever it is, it's all really vague comments. And it doesn't really tell us what the ambulance is actually doing. Where are you going? Like, do you make a lot of runs to a nursing home to put people back into bed that fell over? How many people are drug overdoses where you pick somebody up off the sidewalk? I don't really know. And, people ask me stuff like that, and I have to say, I don't know. It just says sick person.
I can play with that and I can put some of that data together. Even what you see there it was picking one data set to throw in a chief's report. The stuff you see there is the stuff that we're actually dispatched to. If I pull the numbers of actually what was wrong with those people, it's completely different. So I can pull some more data out there it's all, there's a whole bunch of data.
Don't we often not really know what's wrong with people? You pick them up in the ambulance, you take them to the hospital, you drop them off, and you never hear what the diagnosis was. The hospital determines that, and they don't necessarily tell us.
So our medic still has to put in a provider impression. They have to determine what was wrong. We do have, that was one of the things we're trying to get spooled back up. That was actually one of the projects Kyle was working on. Mm-hmm. And really just picked, it was sepsis. It was a couple different things to truly match up the higher acuity things that Dr. Mancera had talked about. Was what the paramedic said was wrong with the patient, what was really wrong with the patient. And yeah, that was the project Kyle was working on that now we have not been able to fill that spot. We do have a connection with the St. Mary's system that our providers actually can go in. It's part of an interface. So our providers can go in, if they drop off anyone in an SSM system, can go back and look up that patient and actually see what the patient's ultimate discharge diagnosis was. We have not gone and looked at that collectively, though, to see. It's really, at this point, we're using it for our provider feedback. We're not looking at it as a system-wise. Are we, as a system, correctly identifying what's wrong with patients?
Would we get into patient confidentiality issues if we try to follow up on some of that or not?
I can keep it de-identified enough. Part of it is we can use that information for operations, and that's why I can disclose what we have, because technically telling you that 64% of our people are in Fitchburg and 20% of them are falls, that's actually patient information. Yeah. So as long as we can keep it, generalized enough that you don't know what houses we're going to and what's specifically wrong with people, I can give you statistics.
Yeah, it brings up an interesting thing. You talk about falls and nursing homes and that. What's going to be the long-term impact of the aging population? It seems like that drives a lot of what we do, and we don't really, following up on what Dave was saying, it'd be nice if periodically if there was a profile of age demographic that we're serving.
Sure, and I don't know that that's in the annual report. I know we throw a lot of numbers in that annual report. It might actually give you genders and ages. That's something I can easily, again, they're all data sets. I can bring that up every month or pull some more data for you and easily do that. One of the things I know is in the the annual report that when you look at is where we're going, there is that heat map in there. It's printed in color, and as you can imagine, you can
Yeah, senior living.
you
and nursing
can
home.
guess where we go a lot. Yeah, there's a little red hot spot over all those little senior housing, which is everywhere, right? You can guess that.
Well, and there's a big building trend in housing for seniors these days.
And I just
That long-term impact on EMS is probably going to be an increase in demand for services, because we're the ones that usually end up responding to those, because they're not staffed to handle all of that stuff.
Yeah, so we just did the CIP presentation last night for the city of Fitchburg, and Shannon is not here. But part of that CIP, part of that 10-year planning, and putting in there the increasing staffing in 2025, adding additional ambulance to that fleet over the next, now just down to 3 years, is within the next, I believe it is within the next 3 years in the city of Fitchburg alone, there will be 5 senior housing complexes and an inpatient rehab or resident rehab center, as well as Oak Hill now has an essentially assisted living center per se out at the prison. So that is a completely, I'm looking at that 3 to 5% in Fitchburg alone, plus all of the construction that's going out in Verona. So they're not getting the identified senior housing as fast, but their population with those large complexes, unless Kate wants to pipe in on that, but otherwise, yes. Yes, that is in the projection. That's why I've been trying to be very proactive, as I know as budgets will continue to get tight, as we ask for more equipment and ambulances, to try to stay ahead of what that curve is, so that we're not all of a sudden playing catch up. And you probably read it in the paper, right? Every other agency around us is having problems with staffing and enough equipment and resources. We are perfect where we should be, which is not, all right, I don't want to stay in a comfort zone. We are taking care of our population. We are getting there. We aren't running out of resources as we were prior to that third ambulance. It was 4 to 5 times a month where some other agency was coming in. We are not there anymore. That's what that third ambulance was for. We're actually providing that assistance to other entities who, it's kind of the payback, and they helped us out. We're helping them out. Now, City of Madison has their next ambulance out at Station 14, so they're able to keep up with some of that, but it's already, it's going to just swing back and forth. But as you bring that up, that budget's going to continue to grow. We'll continue to ask for resources and hopefully just continue to stay ahead of that, looking at what that growth is going to be.
I think I saw something in the paper a while back about grants for EMS providers that the state was putting out.
That actually just opened up on Monday.
Okay.
So
there might be an opportunity for.
So it is very specific on what you can spend those funding for. So I've actually been working with a couple staff members on trying to see what we can do. The idea behind it is that it's not budgeted items. It's things that we haven't been able to get because of other budget impacts. So I've kind of been looking at that wish list of equipment that will improve some of our provider safety. I believe it's $12 million. Yeah, so that actually just opened up on Monday. So I've got a couple template of.
Sounds like you're on top of it.
Yeah, yep.
Well, I'll just say the reason I'm not sure why I brought this up. I've just been very curious about it. I'm a physician, also a retired physician, and the decision to put a bunch of senior housing places in Fitchburg is not made by the EMS commission or the ambulance people or anything like that. It's made by whoever it's made by, the city of Fitchburg. But there may be some preventative things that ought to be added to that, because if that's going to predictably drive up ambulance runs and drive up ambulance costs, maybe there are things that the city could do, not necessarily the ambulance service, by having paramedics go there at a high price and stuff and try to teach people things, but maybe the city can do things to try to prevent so many calls. I'm not trying to prevent needed calls, but I get a sense that there are maybe a lot of sort of nuisance calls, or not necessarily highly needed calls or very acute calls.
So at least in the city, well, not at least, in the city of Fitchburg, we do have, it used to be called the M team, and the name changed because Jeff is part of that team now. Monthly, there is a multidisciplinary team, which we are part of. It's EMS, it's fire, it's police, the senior center, building inspections. Those are places that are actually not necessarily just the senior side of things, though the senior center is involved with that. We do actually meet and talk about, I think really what you're talking about is, are there places in Fitchburg, at least, where we have identified challenges, frequent utilizers of EMS, frequent utilizers of fire, some building inspection problems, do they need help? So that we're all talking and sharing what the limited, we always struggle with having to sit there and keep our mouth quiet a lot, right? We can't say I went to that house 5 times or talk about those patients, but we can be there kind of as a sounding board of maybe we need to look at this facility because there's some residents there who may benefit from some fall related stuff. So that is it happening on the Fitchburg side of things. It doesn't necessarily happen on the Verona side of things, though we do meet as department heads and we have that ability there. But we compete with every other department for funding, but Fitchburg has both Fitchburg and Verona have very active senior centers who we work with when we start finding some patients who could use some challenges. Right now, the senior center, we try to connect the senior center with those patients or the other way around to get them that help, but we could always be better, I think.
Comments? Well, thank you very much for attending and
No, absolutely.
giving
Thank
some
you.
feedback. Any other business anybody wants to bring up? If not, a motion to adjourn would be in order.
I make a motion to adjourn.
May I have a second?
I'll-
All in favor of adjourning signify by saying aye.
Aye.
Anyone opposed signify by saying no. We are adjourned. The motion passed.